Right. Recording in progress. So hello, welcome everyone. We're really glad that you're here and really looking forward to our community and stakeholder engagement for recovery community organizations learning collaborative that kicks off today. This is a 6-month-long learning collaborative. We're going to be offering these webinars about once a month over the next 6 months, and then also offering some additional opportunities to learn and engage with us and our experts in this area and each other in between sessions. So Chris Kelly and I have been and our presenters today, Kobe and Mitzi, have been working on preparing this year's learning collaborative for a while now. I'm really excited to bring you some training on this important topic. And this is a topic, by the way, that you all told us that you were interested in learning more about. So that's another reason why we're really happy we're able to do this. I'm just going to move some things around on my screen here. So just a quick introduction of myself. My name is Nell Hurley. I'm a woman in long-term recovery. I'm a steering committee member at the Peer Recovery Center of Excellence. And as I mentioned, you are here for an introduction to community and stakeholder engagement frameworks. This is the first of 6 sessions in this year's learning collaborative around community and stakeholder engagement for recovery community organizations. So Kobe, you can take me to the next slide. I'm just going to cover a couple of slides here before I hand it over to our presenters today. Funding for the Peer Recovery Center of Excellence comes from SAMHSA, and the views expressed in today's webinar are not the views of SAMHSA. They do not necessarily reflect the official policies of the Department of Health and Human Services. You can read the statement on the slide there. So that's just a bit of official business that I have to do before we move on. So next slide, Kobe. Just a little bit about the Peer Recovery Center of Excellence. You probably, if you are here, then you have heard of the Peer Recovery Center of Excellence. We've been in operation for over a year, but under 2 years. So we're a relatively new initiative funded by SAMHSA. We have 4 areas of focus through the Peer Recovery Center of Excellence. The first one is around clinical integration of peer support workers into non-traditional settings. Then we focus on building and strengthening the capacity of recovery community organizations, and that is the area of focus that Chris Kelly and I work on specifically. The third area of focus has to do with enhancing the professionalism of peers through workforce development. And then we also work to provide evidence-based toolkits and resource information to diverse stakeholders. So there's lots going on at the Peer Recovery Center of Excellence. Hopefully you are familiar with our website. If not, the address is peerrecoverynow.org, and you can click on a tab for resources, trainings. There's all the information is there. So you can kind of sort through things based on your area of interest or need, and look at things through the lens of these 4 core areas of focus. Next slide. Just a little bit about language. We just want to acknowledge before we proceed into today's session that language matters. If we want addiction destigmatized, we need a language that's unified. The words we use matter. Caution needs to be taken, especially when the disorders concerned are heavily stigmatized, are as heavily stigmatized as substance use disorders are. Again, you can find more information about that on the link in the slide there. Maybe you can put that link in the chat, Chris, if anyone wants more on that. Next slide. Thanks, Chris. Just a couple of housekeeping items. We love to see your faces. So if you can, please turn your cameras on. It really makes a difference. It helps the presenters kind of, to be able to see you, and we want to be able to see each other. Don't worry if you didn't comb your hair this morning or anything. We're all in this Zoom life together. As you know, today's event is being recorded. Please keep your line muted when you're not speaking. And you can use the chat and reactions features throughout the training. If you have any questions for the presenters, go ahead and put them in the chat. If you have any questions regarding technology, if you're needing technical assistance, you can chat directly to Chris Kelly or myself. Well, send it to Chris. Yeah, sorry. Feel free to ask questions and respond to the content being presented. So this is meant to be, informative and informal and interactive, and we will have some time set aside at the end for more questions and answers, but Kobe wants questions to come in as they come. So we welcome that. And I think that's the last of my slides. Let's see, Kobe, what's on the next? Yeah, so there we go. So I don't have a big introduction for our speaker today, Kobe Williams. His full bio is on the website. So when you go to the landing page for the Learning Collaborative, there's a lot of information there, and you can just click on Kobe Williams and Mitzi Moody, our presenters today, if you want to read their official full bio. I won't do that now, but I will say that we feel very fortunate to have Kobe and Mitzi with us today. They are experts in their field, and Kobe is the founder and principal of New Reach Community Consulting. He's going to provide us with an introduction to community and stakeholder engagement frameworks. And Kobe, I'm going to hand it over to you. You can do a little bit more of an introduction if you like, but I hand it over to you.
Yes, thank you, Nell. Thank you, Chris, and also thank you, Marissa, for the invitation to be a part of this series, and for thank you all for being with us this morning or this afternoon, depending on where you are in the world today. Yes, I'm Kobe Williams. I'm the owner and founder of New Reach Community Consulting. New Reach specializes in public affairs. I assist organizations connect important causes to communities. And that looks in a variety of different ways, but it's inclusive of stakeholder engagement and community outreach, messaging and issue advocacy, and strategic planning and implementation. This is a topic that's near and dear to my heart. I'm a self-admitted civic nerd and have been involved in this work in some way, shape, or form, quite literally since I was a tween. So for several decades now, you'll have to excuse the 80s. I was still playing with G.I. Joes and Transformers at that time, but love this work and have been involved with it in a professional capacity for going on 20 years now, actually, as a consultant. I've done legislative affairs, I've done grassroots community organizing, and all things in between. So it's a pleasure to be with you all and share some of my experiences, knowledge, and information for the next several weeks. And I'd also like to invite Miss Mitzi Moody to introduce herself and tell you a little bit about her background and how she'll be engaging with you all as well.
Yes, thank you, Kobe. Again, I am very happy to be here with you all today. I am a social worker by training, and this is something that definitely resonates with me and is why I get out of bed every day, right? I am the owner and president of Creative Thought Consulting, and what we do is we exist to support communities and nonprofits, because we know when communities lead, the world changes, right? We see a lot of impact and change from communities leading and taking the lead on community initiatives. And really being leaders in their own communities. So that's essentially what Creative Thought is here to do. So again, I'm very excited to be able to work with you all as a trainer, and then through the extension learning, which we'll talk about a little bit later. Just a little background about me. I am in Ohio, not from Ohio, in Ohio, and have done a lot of work with in Columbus and Franklin County with the Mental Health and Addiction Services Board here. And part of that was in my time just really helping to embed and infuse peers into all the work that we did with our mental health agencies, with county organizations. And so this is definitely something I'm very excited about, to be able to continue to share some knowledge with you all and also learn from you. So again, just very excited to be here, and I will turn it back over to you, Kobe.
Thank you, Mitzi. So we're going to jump in here with some definitions. I like to do that to kind of level set. And community engagement is a really interesting phrase. I presented for a conference over the summer and looked up the definition of community engagement. And it's interesting because no one really owns it. It's a combination of two words, actually. And so I went to Wikipedia. And yeah, I know Wikipedia, it's not real stuff there. Everything that's in books isn't true or accurate either. So that's my defense of Wikipedia. So it does have its merits. And this is a definition that I will offer from Wikipedia on community engagement. A dynamic relational process that facilitates communication, interaction, involvement, and exchange between an organization in a community for a range of social and organizational outcomes. So a lot of words there, but something that really stands out to me about this definition, first of all, is that it's agnostic towards methods. It doesn't say that it has to be social media, it has to be Twitter, it has to be Facebook. It also doesn't say that it necessarily has to be in-person meetings. And the reason I mention that is particularly, we're knock on wood coming out of the pandemic. It's been upwards of 2 years now. That really fundamentally shifted what community engagement looked like. So if folks were maybe potentially over-relied on a lot of in-person things, well, that just wasn't possible for, various phases of the past 2 years. And social media has its limitations as well. So the bigger point that I want to make there is that community engagement is really its truest form, is agnostic to the actual method itself. And the real intent of community engagement specifically, and this is the perspective, the lens that you'll really hear throughout the series, is that the point of it is to make a difference. The point of community engagement is to make a change. You see it referenced there for social and organizational outcomes. Something I differentiate between community engagement and maybe some other type of events, it's different than a birthday party. You have a birthday party, you don't necessarily need a reason to be there or ask people to be there other than maybe some cake and some singing. Community engagement is very intentional. We'll get into what it can look like, but I definitely want to introduce that for something to really think through and maybe even wrestle with. Gatherings and what have you are certainly a part of the process, but it's usually a means to an end, and that end is to make a difference. And one other term I also will toss out is you'll hear me reference the term issue. Issue in the community engagement world is a problem with a solution. So an issue is a good thing. We'll touch on that in future sessions, but if you kind of just say what problems are and leave it at that, that's really not very exciting to engage people with, be it people you want to get involved with whatever you might be working on, and or people that you might be engaging with to help change, to make a difference. So we'll touch on that. So again, an issue is a problem that has a solution. And that's very important to keep in mind for community engagement and the work that takes place. For New Reach, the organizations I work with are specifically to work on that. You know, what is a solution to problem, and that's something that New Reach assists public sector, nonprofit, and philanthropic organizations with, because that is why they exist. They exist to help make a difference and make a change. So we won't spend a whole lot of time on this slide because there's a lot of information there. Feel free to take a screenshot, take a picture if you're able to, or check out the recording afterwards. This is one of my favorite images, and interestingly, it's kind of disappearing from the internet. I didn't think that was possible, but I came across this several years ago. And this is kind of an overview of stakeholders, is what we'll cover here. And it's really a bird's eye view of what I call the threads that kind of hold a community together. And this is borrowed from, I believe, the UK. So some of these spellings in the terms might not translate completely, but they are certainly synonymous with a lot of terms and individuals and organizations that exist, assuming if you're joining us from the United States. So on the right-hand side are the stakeholders specifically. And on the left-hand side are kind of the resources, or how they might be able to assist is one way of thinking of it. So on the right-hand side are the stakeholders, and on the left-hand side is kind of what they do, or what are our activities and or resources. And the most center of the circle there, the darker orange, is kind of the micro level. That's kind of the individual level of community engagement and who some of those stakeholders can be. The centermost circle are examples of organizations. Some of that word I might use a little differently, but organizations or associations, generally speaking, membership based. They generally speaking provide programs. They are that's a way to describe them. And then the outermost circle, I traditionally call them institutions. And institutions, generally speaking, are entities that exist to really provide services or to demonstrate philosophies, for example. So government, it exists to largely deliver services. School systems largely exist to deliver education. That's why they're there. So that's how I would describe it. The outermost, again, I tend to call that institutions. They exist to instill different beliefs or philosophies. And what is listed there as associations, I might call that organizations. And those are, generally speaking, membership-based and deliver programming. So the real point of that is really, I'm a big fan of exposure and just being in awareness, being aware of what are the different pieces that exist in communities. Some you might not necessarily have thought of, you might be a part of, or you might not be a part of. So who are the players, and also what do they do, is a way to summarize this slide. And how I would define a stakeholder as well. Stakeholders are everyone. So if you take a trip, if I were to take a trip to Chicago and spend a couple of days in Chicago, I am a stakeholder during my time in Chicago. You know, if I bought a plane ticket, you know, that's a way that I'm a stakeholder in the level of my initial engagement. If I, you know, hit the road and get some fuel, well, I'm a stakeholder because I made a purchase. So there's different, everyone's a stakeholder. There's different levels of what a stakeholder might be and how it might make sense to engage with them. So I want you to keep that in mind. We'll dive a bit deeper into that in future sessions, but everyone is a stakeholder. There's different levels of stakeholders and whom they are and how you might decide to engage with them. So here's another cool slide that I like. It's really a high level view of different roles that can exist within a social change ecosystem. And, you know, one thing I really want to point out in this is that you might wear one hat, you might wear multiple hats. And there really is not anything bad about any one of these inherently. There's just differences between them. And we won't have the time to dive deep into these. Each one of these could be their own session or series unto themselves. In the center there, again, the nature of this work is about making a difference is how I would summarize it. And some ways that can be demonstrated are in the centermost kind of the yellow circle there. So it says equity, inclusion, liberation, justice, solidarity, resiliency, and interdependency. And just quickly going around the circles there, we have weavers, we have experimenters, we have frontline responders, we have visionaries, we have builders, we have caregivers, disruptors, healers, storytellers, and guides. And if I didn't already cover that, weavers. Again, each one of those are their own disciplines in many ways. And I would encourage you to, if you have questions, you can put them into the chat or save them to the end. But encourage you to really think about maybe what hat you are wearing now, or maybe what hat you might want to be. And have you thought of your role in the work that you do in this type of way, and towards the again, I mentioned that means to an end. Many of the ends that are suggested there, what that might look like for you. And one analogy, I use a lot of sports analogies, mostly the NBA. You'll hear from me a lot. One way to think of this is maybe positions on a team. What might your position be on a team or in your community? So that's something that I'll ask you to keep top of mind. So here's the ladder of involvement. You might see this appear as the ladder of engagement or tiers of engagement, fairly synonymous terms. A very common principle when it comes to engagement. Obviously, you have a ladder there. Sometimes you'll see it appear as a pyramid. And so the left-hand side is, titles. You can think of synonyms for them, but titles as well as the activities. And we'll start with the bottom, so kind of the bottom rung of a ladder. Generally speaking, hopefully you're climbing a ladder starting from the bottom. So we'll start there, and that's kind of the thinking that goes with traditional community engagement and stakeholder engagement. So there's awareness. Awareness is where people know about the campaign. A campaign can be synonymous with a project, an initiative, a program. Again, you can use different synonyms there, but the real essence of the word campaign is the intent that you're doing something to make a difference. So awareness is where most people are. So there are certain things that we all are probably very active in, very passionate about, very engaged with, but that's probably, generally speaking, the minority of things. For example, I like animals. I respect animals, think they're cool. They were here first, this is largely their turf, but I'm not super engaged in that movement or that cause. I have a general awareness and I care, which is okay. The next level up from there is, okay, you have a working awareness. It might be kind of, okay, you might have heard that on the news, you're generally aware of it, you've heard of it before. Understanding is where you become more knowledgeable about an issue. You're more so following it with a degree of intentionality. That's the next step up from awareness. Then above understanding, you have supporters. So where understanding and awareness is a little bit more passive, supporters are a little bit more engaged. It's where you demonstrate support for something. And there's an example there. You might like a Facebook page. Maybe you sign up for a newsletter. Maybe you attend a meeting. Maybe you attend a webinar. Again, it's on a path towards more intentionality, and you're more skin in the game is another way to articulate that. Then you have promoters, and those are individuals who are actively sharing what they are doing with others. That's where you really kind of generate fans. Going back to my sports analogy, hey, did you see that game? Did you check it out? Man, that was awesome. That's where you're more more skin in the game, and you're starting to generate more external interest. So whereas the previous rungs, the awareness, the understanding, and the supporters are going to be more passive, a little bit more on an individual level. With the promoters, you're more external with the thing that you are interested in, involved with, or passionate about. Then you have activists. Activists are people who really take on roles and engage with a community or an issue. A little bit different than a promoter. A promoter, generally speaking, is you're kind of you're passing the ball in some regards. You're sharing what others have shared with you. Arguably, an activist is where you have more ownership of the role of the work, and you're more engaged with it. And then the upper tier of the ladder, again, you might see this as a pyramid. And if you think of a pyramid, the top part is the sharpest, it's the most acute, it's the smallest. And that's generally speaking how this type of work goes with community outreach and stakeholder engagement. Is leadership is generally the smallest part of the crowd. They join the team and dedicate time to taking the campaign forward. So again, we realistically, each one of us serves a different role in different things that we are involved with. And the bottom rung, the awareness, is one that we're probably the most, that's most appropriate for our role in that cause, that effort, or that community. And generally speaking, the leadership role is the smallest crowd. And I want to say that that is okay. And it's just more so, again, being aware of where you are, as well as, what's possible for additional levels of engagement, be it, with you personally and or the other organizations or communities that you work with. And on the right-hand side, I'll wrap up with this slide, is helping people up the ladder. Again, this type of work is very intentional. Ideally, you want to help move people up the ladder as they are interested, willing to do, but a lot of that is really geared towards presenting those, how you present those opportunities, which we'll cover in other sessions. So how do you help people up the ladder? You inspire people to get involved. That goes back to, an issue is a problem with a solution. If issues are presented, or problems just doom and gloom and that's it, and that's not very exciting to get people involved with. And an early tip is that decision makers like when you bring solutions to them. That's very helpful. We'll cover that in later sessions. It helps people stay connected. They stay involved. There's a path for how they are or can be engaged in the work. Get to know people and what they like and what they want. That's called self-interest. We'll dive into that in upcoming sessions, but it's not just about what you want, what you care about. It's very important for that person that you're engaging with, that community you're engaging with, for it to make sense to them. People have, different seats in the arena, different seats in the stadium. It might be the same game, but the perspectives might be different, or why they're there might be different. So that's important to really get to as well, and to understand. Recognizing efforts, that's a big thing. Recognizing, regardless of where they are on the ladder, they're there. And it's important to recognize that they are there and to acknowledge that. Celebrate together. So this is very tough work. Some of you all know that extremely well. And it's important to self-care, is another way of putting that, and to celebrate together. Provide more opportunities for involvement, not just on the ladder, but if they just want to stay on one rung of the ladder, fine, more power to that. But what are other ways that they can be engaged in that, in that stage or in that activity? Training and support, this is a perfect example of that, the time that we're here together in the upcoming weeks. So definitely kudos to Nell, Chris, and their team for that. Ongoing training and support, we cover that. Responsibility, handing over responsibility. These final 2 points are big ones that I see, quite frankly, most individuals, most organizations really struggle with. Empowerment is a big thing with community outreach and stakeholder engagement. So, you demonstrate that by sharing responsibility, by handing over responsibilities. That's really true in empowerment, trust as well, and involve people in decision making. So, ways to work together. The next few slides will cover a few examples of the most common ways that, be it individuals, be it organizations, or even communities, tend to work together. And the first one we will cover is partnership. And a general definition that I will offer is it's a relationship between organizations or groups with shared interests, cooperation, and responsibility towards a common goal. So, a partnership is one term that most of us probably have a general working definition of, be it from our personal and or work life. A couple of points I really want to make here is going back with my, MBA analogy. This is another way of saying a team. A team has a shared responsibility. So some of the operative words there are word is shared and a common goal. It is also, I would suggest, one of the most fragile of the frameworks that that I'll be sharing with you during our time today, because it's typical of a personal or professional relationship. If one individual, one organization, or one community feels like they're carrying too much of the weight for an extended period of time, well, that will destroy a relationship, that will destroy a partnership. And I want you to keep that in mind as we move through some of these other slides. So again, partnership, I think the most operative words there are arguably shared and a common goal. And really it's being in tandem, it's being in sync with one another, with others that you are working with. Another example of ways to work together is a coalition. A coalition, I will suggest the following definition, which is a temporary alliance between diverse organizations or groups for a common and specific purpose. And I'll spend just a bit of time on here. So if a partnership is a team, it's I'm a lifelong fan of the Lakers, so I'll use that as an example. The Lakers is a team. They work together, they play together day in, day out, night in, night out. Yes, they might get new teammates, but they're still one team. Using that same analogy, a coalition would be similar to an all-star team. It consists of selected individuals from different teams who come together for a period of time, different than a partnership. Operative words I would offer from a coalition is temporary and for a specific purpose. I oftentimes see a lot of these terms get used interchangeably, and and I'm big on, you don't have to memorize these terms. Again, I'm back with exposure and awareness. I would argue that if a coalition has been around for a really long time, I see this a lot in my work, they probably aren't truly a coalition and or aren't as effective as they probably should be. Because again, just going back to an all-star game example, they play together, their goal is to win, usually the East versus the West, and then they go home, they go back to their teams. They're not together indefinitely. That's not the power of a coalition. The power of a coalition is cross-pollination. You bring together experts from different fields, communities, walks of life, you form together for a finite period of time for a finite purpose. It might make for strange bedfellows. Something else that I see a lot in coalitions is working with what I call usual suspects. So we're working with XYZ organization because we're an XYZ organization too, and we've always worked with them. Fine, more power to that if it makes sense. A coalition is also an opportunity to look outside, think outside the box and look beyond your borders as well. It's an opportunity to bring other folks to the fold. Again, that's where you might get strange bedfellows, which is fine. Another point, I'll keep hitting home on this, is that it's a temporary group of people who are coming together for a purpose. Coalitions should dissolve at a certain point. If a coalition has been around for, I would suggest for, years, it probably isn't a coalition truly, and it probably isn't all that effective or focused. An example is you're XYZ organization and you work with 1, 2, 3 organization, an ABC organization. So you might have different focuses. That's fine. You're coming together for a specific reason to accomplish something by the end of the year. And then you reassess after that. And then if you're going to work on something else, then, you start the coalition from scratch is really the more effective way of really moving the needle and making a difference. Many coalitions think they're a partnership and they're not, and vice versa. So that's why I really offer and encourage you all to really think through where you might be, how you might be functioning, and if it is truly in the way that you intend it to be. We also have networks. So the definition that I will offer is that a network is a loose association of people and groups with a common interest or concern that shares information, resources, and ideas. Going along with my sports analogy, I would suggest that a network is kind of like the league as a whole. So you have teams, you have the Lakers, you have an all-star game where selected individuals come together for a finite period of time, and then they go home, they go back to their team. A network is the league as a whole. It's, everyone is connected to it in some type of way. Some might be coaches, some might be players, some might be staff, analysts, what have you, but it provides an infrastructure to share information, resources, and ideas. It's somewhat a little bit more nebulous. The real point of it is really resources and infrastructure is what I would suggest. I think that many so-called coalitions are really functionally a network in my mind. So again, if a coalition, in my opinion and experience, has been around for definitely for several years, it's probably more realistically a network. And you can call yourself whatever makes sense. Again, I'm a practitioner, so yes, the terms absolutely matter and make a difference. But I would encourage you at least to think of how your organizations or the communities that you work with are actually functioning. Are they calling themselves one thing, but are they truly functioning as a partnership? Are they truly functioning as a coalition, or are they truly functioning as a network? I offer a resource down there as well, which I'll do periodically if it comes to mind, or it's also included in the slides, of the collective mind. Every resource that is offered from New Reach is, I receive nothing from it. It's just folks who do great work and offer as well, very generous with a lot of free resources as well. And Collective Mind is an organization that specializes in networks on actually the national level. and they provide a lot of free trainings, webinars, panel discussions, what have you, on that very topic. So I would encourage you all, if you want to learn more specifically about networks, to check out Collective Mind, based in DC, but they have teams literally all over the world, and that's their specialty. See a question from in the chat: what networks am I a part of? A lot. I'm part of a lot of networks, locally, regionally, and nationally. I wouldn't say so much internationally. Focused on some of the work of community engagement in general, from community stakeholder engagement. Also very active in a lot of what's now known as DE&I work. I tend to call it social justice work specifically, and other practitioners in this work. I am issue agnostic, so I'm involved in a lot of stuff, and that kind of dictates, what networks that I might be a part of. But again, how I'm a part of it goes back to the latter. It varies depending on interest and time. And I also want to acknowledge the chat, and please, Nell or Chris, feel free to call things out that I know that I have missed. A little tricky speaking and monitoring the chat, but please feel free to do that as we move along in these slides here.
Sure, Kobe. We did have one question from Carlos. Carlos, I can either ask the question for you, or feel free to unmute yourself.
Oh, hi. I got through. I prefer that if you could to read my question.
Absolutely.
Please.
Yeah.
Thank you very much.
Yes.
Thank you very
Happy
much.
to.
Yeah.
So Carlos had said, we need to train community leaders, train legislators, create public policies, create methodology, I can't say the word,
Yes, that's a tricky one.
and communicate it and benefit our target groups, obtain startup funds and extension funds. And he posed, what do you think? So I think part of this might be answered throughout the upcoming sessions, but I'll just put that out there to you, Kobe.
Short answer is yes. Yes, 1,000 times to any and all the above. And yes, we will touch on some of that through the sessions here. And it'll come up in some of the earlier sessions. Is I'm a big fan of intentionality and knowing. I'm a big why person. Why, what, and how to engage people on different issues. If you do a lot of that work on the front end, in my opinion and experience, it makes the additional work, I'll say, smoother. That the work is not easy, but it makes it a little bit smoother. But yeah, I just mostly want to co-sign what you said, Carlos. We will be covering some of that in these sessions and examples of what that could look like. And I mentioned that's why the slide with the circles on it, the orange circles, is one of my favorite slides that I have in my toolkit, because it really puts out on a high level who some of those players are, and the stakeholders that can be involved. Again, everyone's a stakeholder, but what does that look like? Maybe this group is training. Maybe this group is engagement. Maybe this group it's resources in terms of they have a community room that we can meet at. A lot of times people, when they think of resources, it's just money, but it includes time and talent as well. It includes assets such as infrastructure. So all of that, keep that in mind of how and what can be utilized as you all do the important work that you're doing in your communities. Any other initial questions that I might have missed from the chat, from the slides that we have covered thus far?
I don't see any new questions, and I had
Okay.
posted the question, Kobe, about what networks are you a part of, more so for our audience, to get them thinking about the different networks. And I do see, I think it's Vaughn who's here under Lori's name, because I know Lori and I've met Vaughn. But I think an important one for this group is the Association of Recovery Community Organizations. And that would be a great opportunity for any recovery community organization to get connected to that national network of other recovery community organizations.
Thank you. Thank you. And I see good examples from Lori in the chat is, yes, absolutely. Work with your folks is what I call it, so people who might be active, involved in, the recovery space. And this goes for any organization. Who are other, stakeholders that might be involved? And we'll touch on that in a bit in upcoming sessions, but, how potentially to move beyond the so-called usual suspects, whom are other organizations or entities that you might be able to get engaged with your work. Every individual, every organization has its strengths and weaknesses. And I think that's a real power of partnerships, coalitions, and networks, is how those are leveraged. So, what are the different types of organizations that might team up to work on an issue, to move an issue forward? So I'll move to the next slide here, which are types of advocacy. And I want to touch on some terms up front in advance, and I'll use continuously through our sessions and our times together. So advocacy, activist, organizing, things along in those words, those can be jarring terms. I've been in this work a very long time, all day, every day, and it's jarring, in my opinion or experience, usually to people who are associated with power or privilege. And it's oftentimes because advocacy, organizing, activists are challenging that. I argue that most nonprofits, specifically nonprofits exist, they exist to fight for something or to fight against something. It's in your mission statement, it's in your vision statement. You either want more of something or you want less of something. That is advocacy. So I encourage you all to embrace those terms. You don't necessarily have to wear all of those hats. But again, I think the polarization is usually tied to power and privilege and those who might be associated with it. It is literally the origins of the rights, the holidays, the religions, et cetera, that we have. Certainly here in assuming you're joining us from the United States, that's why the country was founded. A lot of the sessions that we will have with you all, it's through a DE&I lens. And there's the big 8. It's race, ethnicity, sexual orientation, gender identity, ability, religion or spirituality, nationality, and socioeconomic status. How you might identify, in my opinion or experience, is usually, again, associated with maybe your take on the word advocacy or maybe even those actions of advocacy. But I also want to share, particularly if you're from racial or ethnic marginalized communities, it's intertwined with my history. So to be, cognizant of that as well. It's how or why I'm, able to speak with you quite literally today. So its meaning is very different, I think, depending on who, what, or where you might be associated with. And with this particular slide here, it's different types of advocacy. We have research, we have support, we have political, we have outreach and education, and we have fundraising. So oftentimes a different, maybe individual, an organization, perhaps a community tends to really be, their bread and butter might be one, perhaps a couple of these things. So you might be research common example are think tanks. That is the thing that you do. Fundraising, that one is more intuitive. These circles are different ways that perhaps an individual or organization can plug into a partnership, can plug into a coalition, or can plug into a network. The point being is that no individual or organization realistically can nor should be expected to be all things to all people all the time for every issue. So this slide is an example of the different types of expertise, maybe focus or activities that can contribute to an issue, which again, an issue is a solution to a problem. And hopefully that makes sense for you all there on that slide. But again, encourage you all to lean into, again, advocacy. That's the point of community outreach and engagement. That's what differentiates itself from having a birthday party or having a cookout. Those are cool things. I'm all about that. And maybe that is a way that you help move people up the ladder, but that's not the end game for the nature of this work. And please do, you have questions, comments, reactions, invite you to continue to enter that into the chat. So this is a social change spectrum. There are slightly modified examples of this, but pretty common example of the spectrum of social change. I really like this one because it gives very specific examples. So on the left side, you have, generally speaking, it's models that accepts the existing power relations. And on the far right side are general examples or models that challenge existing power relations. Again, with engagement work, it's advocacy. You're fighting for something or you're fighting against something. That's just, that is what it is. And power, again, is oftentimes something that might be a term or concept that could be jarring depending on who you are. If you, for some, that's quite literally a matter of survival. It's, that making a difference is going to fundamentally transform a life, transform a community. So that isn't as jarring for them. For others, it might be, again, just depending on, what you might be associated with. So on the, real point of the spectrum is to know where you are and to know where you aren't, and to really just be aware of that and own that. Each one of these columns has merits. I'll be the first to say that it has merits, but it's understanding where you are, where you aren't. And each one also has its limitations for the ultimate difference that can and will be made in the work that you do, the communities that you engage with, and the stakeholders that you conduct outreach with. So generally speaking, on the far left, as I would describe it, is kind of the grin and bear or go along to get along. And I say that with love. So it starts with direct service, and an example that is given there are service organizations such as a senior organization that provides discounts to its members by buying bulk drugs in bulk. When I was coming up, a common analogy that was given were what used to be called soup kitchens, which are now called food pantries. Does a lot of good. Like, I'll be the first to say that, and it obviously serves a need. The limitation is that it does not address the reason why folks might have needed to come to the food pantry. So yes, people will, their hunger will be addressed, but the cause of their hunger, not necessarily. And another limitation is that it's not empowering, arguably. It doesn't empower the folks to help address their issue. Again, it has a ton of merits, but it's being honest about what it does and doesn't do, that level of activity there. Self-help. The example given here are people who need the drugs in the same example could form their own buying cooperative to get lower prices. So a common example that exists, a growing movement, are food co-ops. And they gave an example of a drug co-op. So it's more self-help, a little bit more empowerment. It exists there to serve a need, but it does not necessarily address the problem directly. Ton of merits to it. Just like direct service, the self-help has a ton of merits to it. Common analogy given is you might be pulling a person out of the river. Yes, do that, save their lives, all for it. It doesn't necessarily address why the person fell in the river. Can they swim? Can you help them out with that? Or, plugging up the dam. So again, it's knowing where you are and where you aren't on the spectrum. Education. The example given here is an organization could do a study on the cost of prescription drugs or the lack of insurance coverage. A common example to that, it kind of speaks to the earlier slide with the bubble on research. Education is kind of in the research area of things, and has a lot of merits. That's where a lot of the data and information and studies and analysis come from, and we more power to that. Arguably a limitation of that is I had a client that I wrapped up a project with a couple of months ago, and really fantastic research work on policy. So kind of this is what is, these are the problems that exist. And during the course of the project, we did some stakeholder engagement with members of legislators and members of statewide organizations. So what do you think of this organization? And as an example, the stakeholders love the work, fantastic, stellar work. A challenge was, but we don't know what to do with it. What does it change? Give us examples of that. Great reference point, but push us, nudge us in one direction or the other. So that is a limitation that I would offer of pure research. Again, going back to the slide with the circles, if that's the lane you're in, fine, more power to you, if you want to stay in that lane. But if you want to stay in that bubble, but maybe how can you pass the ball to others who might be able to move it further down the court is a way that I would suggest. So education, here's information. The arguable limitation of that is, okay, well, what do you do with it? How do you make change with it? And that's where the advocacy comes in. And the example provided here is an organization might advocate for people who need prescription drugs. That is where you might do something with their research. You're saying, hey, here's some research here, something needs to be done about it, about the problem that's being suggested there. So, it can be generating awareness about research that does exist. So that is one example of what advocacy looks like. Again, it's advocacy is all about fighting for something or fighting against something. It's more so, I would describe it as kind of speaking up to some degree. Then you have public interest. That is a column you won't see in all examples of this model, the spectrum, but I like it. Public interest, where you might go beyond advocacy and actually write legislation for a state or national drug insurance plan that the group would attempt to get passed. Oftentimes I see the public interest lumped in with the advocacy. I do like that it's specifically called out. That's really an opportunity, if and as that makes sense, to draft legislation. I'm in contact. I used to do more direct lobbying. I don't do that direct anymore, but I'm still in fairly regular contact with policymakers. And several occasions, they wished that more individuals would do that. You are allowed to do that as a citizen. You are perfectly allowed to do that even as a 501c3. I'm not a lawyer, I'm not an accountant. Get advice from such individuals, but I've done it for years. I've done similar trainings on this for years. The IRS says that you are perfectly allowed to do such activities, and we'll cover that in future sessions. But there are opportunities. A lot of legislation gets, and we won't get in the weeds of if it's good or bad. That's a matter of perspective. But sometimes legislation that is written by the very issues, people, entities who you are against or are against you. The difference is they wrote it. They recognize their right, their opportunity to put something into the policy, the legislative, the political process. So we'll cover that a bit more in future sessions, but that is another opportunity for individuals as well as organizations on the spectrum of engagement. Again, we'll do a deeper dive on opportunities of what that could look like, but it absolutely does exist. And then, the final column there is direct action, which is mobilizing the power that people have. The value of united actions is taught through a real life example, building self-confidence of both organizations and the people involved with it. Direct action, to summarize it, is applying pressure. And again, in my opinion, experience, the comfort level with that is, generally speaking, people with power and privilege. Certain communities, this is quite literally how we are, we're here. And we can unpack that further, maybe during the Q&A and during future sessions. Those are most specifically the people who really have the biggest problem with that concept. Again, it's the origin of the holidays, the religions, the literal rights that we have. It's the reason why folks bring out their grills, hot dogs, and fireworks on Independence Day is quite literally a celebration of that concept. The challenge is usually who wants that and why they want it. So wanted to put that information out there for you all as well.
Kobe, maybe I'll just jump in here quick and draw your attention to the comments that I put in the chat. I just did a little bit of sort of translation around these terms for the recovery community and for recovery community organizations specifically. So if anyone wants to jump in, you can correct me if I'm wrong or add to this, but I sort of think of direct service as a recovery community organization that offers some sort of direct service like recovery coaching or peer recovery support. Self-help would be like a mutual aid group, AA or NA, something like that. Education, an example of that would be like DUI classes that are, I don't even know who puts those together, but someone does. They happen in like every city. So it's education around alcohol and driving while under the influence. An example of advocacy would be like a Recovery Day on the Hill event that might be one of the activities that you're organizing through your RCO. Public interest would be something like the mental health parity law that was passed in 2008. And then I think of direct action as kind of like the whole recovery movement, and the fact that we have we have a color. Our color is purple, and we celebrate recovery in September. We have a month that is dedicated to recovery. So any other examples that anyone can think of that might translate from this list or this spectrum to the recovery community and recovery community organizations?
This is Darren Valdez. We do our recovery community organization is we do art, music, and meditation workshops directly with people in recovery. They have to have 24 hours sober, but we don't. I think you're right. We could, in every grant application and things, they always say you're not lobbying for things, because we do receive grants for these things. So you have to be real careful about that. But I don't know where we fit on the spectrum. I think direct service, I guess, would be what we are. But we don't do any of the, I wouldn't consider it like education or anything. So it's a little confusing, I guess.
Yeah. Well, it brings up another good point, though. It sounds to me like that is potentially a coalition. Would you say that that's right, Kobe? Thinking about different, forms of like partnerships, coalitions, and networks. That's probably a good example of a coalition.
Yeah, I think those are great examples. Yeah. And thank you for that context now. And and we'll get deeper into this, into the more specific session on that. Probably one of my top two myth buster moments is there's a recognizing, funding sources, as many nonprofits think that they are not allowed to lobby at all. Patently false. It's on the IRS's website. You can look it up. The rule is you can't do too much of it. And we'll get into that in future sessions. If you don't do much of it, you can't, you're not in risk in doing too much. That's one part of that. But yeah, definitely, again, get advice from your attorney or accountant or what have you. But it is absolutely a right for that organization to are able to participate in, do several trainings on that topic. And unfortunately, it's even to the point where many nonprofits don't think that they are even allowed to register people to vote. They're so terrified of patently false. And the other end of that is that folks who you might be, causes you might be fighting against, they are absolutely doing those things. So you could be shooting yourself in the foot if there's over caution or completely checking out of some of these activities. If what you're not doing, others are, and sometimes you might get the short end of the stick on those results. And one final point that I'll make on the spectrum is I read an article recently from Nonprofit Quarterly that featured some leaders within nonprofit organizations throughout the country, and they really lamented that a lot of social service organizations think they're social justice organizations, and they're not. And particularly within the past 21 months or so, the social justice movement, which never ended, just more people kind of gotten their head out of the sand on certain issues. They might be talking or thinking that they're social justice, but they're really direct service. And so that's where I really go back to knowing where you are and being aware of that. And what that brings back to, community engagement and stakeholder outreach, as I reference, a lot of communities, the communities that you're looking for, want to make an actual change, want to make an actual difference. And what that difference can be, it depends on what side of the spectrum that you fall on. Again, there's merits to all of them, but it goes back to what I would call managing expectations. So if you're talking or thinking as a social justice, which would be towards one end of the spectrum, but you're really direct service, there's going to be a disconnect, and that's not going to be congruent with your stakeholder outreach and community engagement. And that's something I see a lot in the work that I do, is that the communities that are different levels of trauma or impacted by issues, they're already by and large at the ladder. So the advocacy, the public interest, the direct action, they're there. It's just if who, what, and how are the organizations meeting them there. That's something to be mindful of.
Colby, can you flip back to that ladder slide real quick?
The ladder. Yeah. Sorry, you meant the ladder or the ladder? Yes.
Oh, the ladder. Yes. So just quickly related to what you were just saying, I'm sort of trying to wrap my mind around it. Do you think that organizations can be both, like the direct service and social justice? Or are you saying that they're sort of mutually exclusive?
No example immediately comes to mind for me for an organization. A partnership, well, I'd say more so a coalition and a network, or examples of that. I think it's nothing in me. I think it'd be very difficult, if not impossible, to be both, or at the least, you are a direct service on the path to the direct action. So if you are purely a direct service, there's examples of that where you might work with an organization who does more of the direct action. So I think it's very tough to credibly be both at the same time. More often what I see is that within a coalition or a network format.
Okay.
And it's kind of serving people in different phases is a way of looking at it. And you do what you do. You play for the Lakers mostly, and you work with others as needed, but you can't play for the Lakers and the Clippers at the same time.
Right. Yeah. I'm just thinking about recovery community organizations. At many of them, not all, but many of them are direct service providers, providing peer-based recovery support, but they're also totally a part of the bigger picture. What was the last part of the spectrum? Direct action. And, part of the recovery movement and working to, I think recovery community organizations kind of touch different points on this whole spectrum. So that's probably not counter to anything that you have said. Just interesting.
Yeah, and usually if you're on the first half of that spectrum, typically you have the people. That's the big, you have access to the people more directly, arguably, than in the latter half of the spectrum. So that's one way I usually see that work. And I'll encourage and nudge and push along in these sessions. I would argue that if you do direct service, but just the word term activities of advocacy make you completely nervous, you're probably not doing it or leaning into it entirely, which is okay. It's just being aware and owning that. Again, there's a difference between the direct service, social service, as well as social justice.
Kobe, I just wanted to pop in and bring in some words from our audience that were in the chat. One is Vaughn was saying, within recovery community organizations, one of the things that often prompts us to move from the kind of direct service, self-help, towards the public interest and direct action is the NIMBY. So oftentimes we're serving populations of people that even sometimes RCO goes to open up in a neighborhood and people come out and say, no, we don't want those people here. And so because RCOs have been around for 30, 40 years, I think maybe the initial attention might have been further down towards the direct service self-help. And then as we grew and matured, found ourselves needing to go into direct action, because in order to deliver the direct service, we have to be active participants in the direct action. It's kind of the lens I see recovery community organizations in. And then I did see a question earlier also was Lori had asked about if you could do a little more explaining on the political bubble that was on the advocacy side. And so I'll pitch my thought first, and then I'll let you jump in. So in the political realm, as recovery community organizations and providers of peer recovery support services, we are absolutely, there absolutely has to be advocacy on that front. A specific example would be in 2018 in the state of Minnesota, we were able to advocate to get peer recovery support services as a reimbursable item in people's Medicaid benefit sets. But so we had to be connected to our political structure in order to make that happen, because it wasn't just writing words on a page, but it was going out, doing outreach, doing education, making sure our state representatives knew what peer recovery supports are, how we fulfill a gap in the continuum of care, how essential and valuable they are. And then, of course, you always have to get someone to author your bill, so you can write legislation, but you have to have that person who is willing to bring it to the floor. And then also a couple of years back, Nell and I were just discussing this. It was presented again in Minnesota that people would receive 3 kind of tries at treatment if they were on public funding, and then they would be cut off. That public funding would no longer support future treatment episodes. And so the recovery community mobilized, got together, showed up in that hearing room, and were able to explain to our policymakers how harmful that was, and that most people who have chronic substance use disorder need 5 to 6 episodes of treatment in order for them to come into recovery. And so if we hadn't been there, that might have passed, that law might have passed. And after 3 attempts, if you were receiving Medicaid, you wouldn't be able to access treatment with those insurance monies. And so, Lori, that's kind of how I see our political advocacy through the lens of recovery. And Kobe, I'll let you add anything you want to that.
That's a fantastic, beautiful, I love that example. Yes, and yeah, keep at it. That's fantastic.
Can I? Oh, sorry.
One final thing is they get used interchangeably. So all lobbying is advocacy, but not all advocacy is lobbying. Oftentimes they get used interchangeably. That's not correct. By the nature of the work that you all do, you're already doing advocacy. Otherwise, you'd be working at Target, right? And lobbying, we'll get into this in upcoming sessions, is you're asking for something to be done on a specific piece of legislation. If you're not talking about a specific piece of legislation, that's not called lobbying. And we'll get into that in future sessions. But beautiful example, Chris. I wanted to differentiate the terms that are oftentimes incorrectly used interchangeably.
Can I just add one thing? I'll be quick, I promise. But this relates to the way that Kobe opened the session by talking about how everyone's a stakeholder. Everyone matters. And the work that we do and the work that recovery community organizations do for their community is for the community. And all of this kind of ties back to the importance of communicating with your community, the people who are, experiencing challenges around using substances, and their families and the businesses in the neighborhood and all, everyone. It's like this interconnected web. And when I first started working in this field, my first job in the field was at Minnesota Recovery Connection, which was one of the first RCOs in Minnesota. And I was 12 years sober when I started working there, and I knew nothing about I didn't even really know what the word advocacy meant. It was just a word that kind of floated out there. I did not consider myself a recovery advocate, and it was a very scary word for me. But what I learned along the way is that there are many ways that you can advocate for recovery. for the way that I started, I was like really low on that ladder. You know, I just had a little bit of awareness, like my recovery was very personal, but it sort of opened up and grew, and I learned how to tell my story and to, you know, to talk about recovery publicly. I learned how to partner with other people and organizations to further the mission of the recovery community organization that I worked for, and to, you know, have a hand in like each one of these bubbles. But it's a really important piece, which Kobe, I think you're probably going to touch on this more in a future session, but about how advocacy doesn't necessarily mean testifying, you know, in front of the legislature. It can be, you know, learning how to talk about the recovery movement at your local, you know, block party or neighborhood barbecue or something like that. And I just love the idea that everyone is an advocate, whether you know it or not, and that that everyone is a stakeholder, and, you know, to really, you know, that this is all about communication and engagement with all the people that we interact with, you know, every day, whether it's, you know, through just out on the street or through another organization or whatever. So those are great points. Thank you.
Thank you, Nell. And I am going to conclude. I'm a bit over time, and I'm going to yield to Mitzi, Nell, and Chris for some additional information. I'll leave you with this quote. We are the ones we have been waiting for. Maybe you've heard that before. And it really goes to, you know, how can we help make a difference, really? That's how I would simplify it. And yes, we need one another. There's interdependency. However, what's the difference that we can make? And it's one of those quotes that's very difficult to attribute to anyone specifically. But the closest I got to it was a woman by the name of June Jordan, who was a Black poet and activist. So I want to give a shout out to her, and particularly for Women's History Month. With that, I will yield to Mitzi and/or Nell and Chris.
Yeah, Mitzi, go ahead. We'd love to hear about the extensions work that's going to happen.
Absolutely. Thank you so much. And Nell, I think you created a great segue into this. We are all advocates. We are all working in some, I love that spectrum side, because we're all working in some capacity in there towards advocacy, towards reaching social justice for people. And so I'm really excited about that. When it comes to the Extension Center, I'm very excited because not only are we going to have the opportunity to have these monthly workshops with you all, but we're also going to have the opportunity, we also want to invite you into the opportunity to practice some of these skills. So one of the things that you'll find in the Extension Center or the Extension Learning is an advocacy challenge. So that is going to be the opportunity for you all to find just one engagement strategy that you've learned about during these workshops, or one that you may not be as familiar with if you're familiar with several of them, and practice that. So for example, as we talked about, it might just be something as simple as sharing a social media post, or creating a fact sheet, or maybe interviewing an advocacy organization in your community that you're passionate about to understand different strategies that they're using. If you look at the Extension Learning site that I think Chris just posted in the chat, you'll see a worksheet called the Advocacy Challenge with a list of different activities that you could do. I think the thing that I love about this is that when so I also teach at OSU, and when I have my students utilize this, they always come back and tell me that they thought it was easier than they thought it was going to be. And they're surprised how easy it was to write their local legislator or call their local legislator and about an issue that they were passionate about. And they've always found that it was, they may have been a little intimidated at first, but when they actually started working and doing the things, it just opened up the pathway for them to just start taking a lot of these engagement strategies and putting them to use. So we wanted to invite you into that opportunity as well. And then the second part of the Extension Center that you'll find is we wanted to provide you additional resources to continue the conversation, to continue the discussion and the thinking, the critical thinking about these topics throughout the course of the month when we're not meeting. And so you'll also find some reflections there that will present you with additional resources, such as a TED Talk or a podcast or a resource for you to check out, for you to kind of browse around, listen to, and also it'll provide you with some questions around how this relates to the work that you do. So there will be a number of different topics that will segue from each of the month's workshops that will just continue that conversation and that learning. So this month you'll be looking at the Community Toolbox, which is a resource that provides a number of tips on engagement and advocacy. We'll invite you to look around that toolbox, and then as you look around it, think of there's a few questions to kind of get you thinking about how you could use more of those tools in the work that you do to really advocate for the change in your community and the issues that you're passionate for. So each month, look forward to those. They will be out there, and then we'll try to carve in time during maybe the Q&A if there are questions that come up from maybe you've tried something. I'm really excited to be able to train with you all next month, and really just to hear, from you. You're all experts in what you do. You all bring something to the table. And that's why I really am passionate about learning collaboratives, because it's really nice to hear and build those networks, between one another, so that when you do have a question, there's someone that from this network that maybe has said, hey, I've done assessments, or I've done this engagement activity, or I've called my local legislator, that you could then reach out to, that could definitely be a support to you on your journey to increasing your engagement. So we really wanted to provide the extension learning to you as a way to just kind of continue to practice those skills, to build the community within this learning collaborative, and have you all be able to put into action the resources, the materials that you're learning through these workshops. So I'll turn it back over to you now.
Thanks, Mitzi. So we're right at time. I wanted to just draw everyone's attention to the QR code for the survey. You can either use the QR code on the screen, just take a picture of it with your smartphone, or you can use the survey link that is there. It takes 2 minutes to do the survey. It really helps us out with our funders. And I want to thank our presenters, Kobe and Mitzi. You did a great job. And I think that this whole learning collaborative is going to be really rich, and these sessions are going to build on each other. So please register for next month, and reach out if you have any questions. There's lots of information and resources on the landing page, and have a great day.